And you're now live, Dave.
Thank you. Well, good afternoon, everybody. Welcome to the local Outbreak Engagement Board on Thursday, the 18th of March, 2 p.m. I've got absences of Gary P, so I think he needs to set the connection if somebody could do that. I welcome Simon Bryant, our Director of Public Health. We have an agenda which Simon's going to give us an update, as he always does, on various issues, including infections and vaccines. We'll all then get some members' observations as to what we want to ask him or update, and then we'll talk about media messages going forward. So I think without further ado, Simon, I'll hand over to you.
Yeah, apologies, sorry.
Yes.
I think we need to confirm the minutes of the previous meeting.
Oh,
first,
I'm sorry.
Declarations of interest and then public questions.
You're absolutely right, and I'm holding the minutes in my hand as we speak. So first of all, item 1 is to confirm a true record of the minutes on the 11th of February. Are members happy for me to confirm that to be an accurate record?
Yep, agreed, Chairman.
Okay, that's good. Do members have any declarations of interest that are not already recorded in the usual appropriate place on their records in relation to this matter or any matters on the agenda?
Yep. No declarations from me.
Good. I hope Councillor Mosdell's with us and she can hear us okay. I'm sure she's on that. Right, and are we aware of any public questions that we should have responded to?
I haven't been notified of any, Chair.
Okay, so we'll then move on now to item 4, which is the reports of the local Outbreak Engagement Board. Update on the current situation, Simon Bryant. We can't hear you at the moment.
Many thanks, Leader. I'm just going to share a presentation if that's okay.
That's fine. Wait a few seconds.
I'm not sure if I'm live yet.
Yeah, you are, Simon.
Great. So, colleagues, you've seen these presentations before, so I'll go through that and give you the summary of the data, and then I'll talk about a few updates as well, if that's okay with you. So this map, as you've seen before, shows how the pandemic is progressing through the country. Just to note the new scale, but we can see the rates coming down everywhere, including the Isle of Wight, which is now a rate less than 25, so in that lowest category. So that's really, really positive news. I think just to say that we can't be complacent about that, because we've seen other areas where the rate hasn't come down so fast. So we're doing a lot of good work to bring that down. But that means we just need to kind of keep that good work going. And we've seen it in different social groups and different parts of the country kind of progressing differently. And then we look at the southeast. Our R value is 0.6 to 0.8, so reducing mean that one person infects less than one person, so that's really good news. And we can see the rates across the southeast are coming down. You remember previously that was quite a purple map with those high rates, so that's really good news as well. And then across our ceremonial Hampshire, as it's been nicely labelled, we can see the different rates, cumulative rates across the pandemic. So that means the rate of infection from the start of the pandemic back in a year ago now, March 2020, right through to now. We can see the Isle of Wight here is below Southampton and Portsmouth, just slightly above our colleagues in Hampshire. And then when we look at our data, so our 7-day rate shows the number of people who are infected in the last 7 days, and that's 21.2, with a rate, a number of 30 new cases for the Isle of Wight. And that brings our total number of cases to 6,694. And where we are in the pandemic with a small number of cases, which is really positive, what we'll find is with new any new infection, and that rate may bubble up and down, so it's going to be fairly steady at this point, but it may go up if we get any new cases. And we're doing more testing now. We are now testing people asymptomatically through our centres and through schools and through parents being able to test. So we may well see an increase in cases, but like we had previously in the first phase, a different testing regime. It's a different testing regime, so we need to bear that in mind as we look at the figures. And this map just gives those figures across our local area, and they've given us the southeast areas from Public Health England. And again, you can see slightly varying rates across the patch, with the Isle of Wight here at 21.2, but coming down, so that's positive. So that's slightly different timescale, but again shows where we are in comparison to others. Yeah. And then the groups most affected, we know that it's the working population and the older population who's most affected by coronavirus, and that's because they're going out to work, but decreasing across the whole of all our age groups, which is great news. And then the latest hospital data shows that this showed 16 people in hospital, and that's steadying off. So we're fairly steady across the whole of our region, and these are the 5 hospitals that across Hampshire and Isle of Wight that we look at, and you can see for hospital rates it's coming down fairly steadily. However, for ventilator beds, that's fallen a little bit more slower in some of our hospitals, but really good news, the Isle of Wight. And at this point, there's just 2 people in hospital on ventilator beds with coronavirus. Again, very positive. And then when we look at our excess deaths, so this graph shows the number of deaths by week. Just to remind the board, there is a bit of a lag with that data for death certification. And the little diamond is the 5-year average, and we are below the 5-year average. And the red bar shows the death with coronavirus on the death certificate. But you can see back in January, we had large excess deaths. And so it's just really good news to see those falling now, and we'll continue to see that fall. So that's really positive news. Yeah. Just to move on, and the next part of the agenda is about actions taken, so we can take those together. One of the key things we are doing on the island is increasing our access to asymptomatic testing. So this is testing via the lateral flow test you'll have heard about previously. We've got workplace testing. That's run by the Department of Health and Social Care, so workplaces can sign up to that. We've got Community Collect coming on board, and that will be linked to our asymptomatic sites that we have. So we've got a number of sites on the island where people who are going out to work or need to go out for other reasons can get asymptomatic testing, and we're moving that to a Community Collect model, and also working with the pharmacies, a national programme to ensure there's pharmacy collect, because it's a really good model with pharmacies in all of our communities. So that's how we're moving forward. But as I mentioned previously, with more testing, we are likely to pick up more people, which is good because we can break the chain of infection. Very quickly, board, I'll just move on to the government roadmap. You'll have seen this a number of times, but I think for this board, our public board, is really good just to remind ourselves where we are. So we're coming up to the 29th of March. We'll have rule of 6 or 2 households able to meet outside, with some outdoor leisure and facilities opening, and then organised groups of parents and children. But again, we should minimise our travel and not have holidays. So that's where we are now. And then we'll wait 5 weeks for the next step, and that's so we can evaluate the impact of these changes. We know the virus is more likely to spread indoors, so we're opening up things carefully and slowly as more people meet, because we know the virus will spread more as more people meet. And then we'll move on to this phase here, no earlier than 12th of April, so hairdressers, leisure facilities, zoos, etc. will open up. And then we'll move on to the third step, where we'll start to have indoor entertainment, so the cinemas, domestic overnight stays, outdoor and indoor sport and other things. But we still need to be mindful that that coronavirus is still in the population, and we need to consider that. And then hopefully by the 21st of June, everything will be opening up again. Leader, I'll stop sharing my presentation there, and happy to take questions as always.
Okay. Can I chip in with the first question?
Please do, on my behalf.
Yep. Okay. So I can't hear the chairman, so.
Sorry, yes, you can.
Okay.
That's absolutely
Thank
fine.
you.
Looking forward to hearing your voice.
We've passed the first point of stage 1, which of course is the schools reopening, and we are aware that that has led to increased testing, both of pupils and parents, and we have seen, certainly here on the island, 1 or 2 instances of schools reacting to that opening up and by all accounts, have dealt with the instances that have occurred very effectively. And I just wonder if we are in a position to create any sort of trend graph which will show the increase in the number of infections that we might expect as a result of all of the schools now being back in session. Thanks.
Councillor Hutchinson is a very good question. I think it's quite difficult at this point in time to draw trends from what's happening. Each situation is different. It's also worth bearing in mind that although we see cases in school, which is where they're tested, they may not have caught it in school. They may have caught it out and about. So what we know is the more people connect, the more it's likely to spread. And so we want that to be as minimal as possible. So as we see, schools have been back really fully, probably secondary schools for about a week as they're doing testing before the schools went back. So we'll keep an eye on that. And as I said, we need about 5 weeks because it takes a couple of weeks for the changes to really implement as people mix. And that's because the incubation period can be up to 10 days. So we'll start to do that. We are looking at that and seeing what's happening. As you say, we are beginning to see some cases in schools, as we have done during all the lockdown when schools were open but not fully, and seeing that further now.
Yeah. Okay. Thank you, Simon.
Thank you. I've got a couple of questions, Simon. I'll just check. Has anybody else got any questions first? No? Okay. First one is in relation to the variants that everybody keeps talking about. Is there any update information for us in respect to the island on variants?
Thanks, Councillor Stewart. So with the variants, we know that they are spreading faster. The ones we know, the one first found in Kent, and then the ones found in South Africa and Brazil. So we don't genome sequence all the people tested positive because we don't have that capacity in the country, even though we have one of the best capacities in the world. So we know that there are variants and they spread more easily. Therefore, we need to stick to the rules even more closely to make sure that actually we minimise the spread of all the viruses. But the predominant variant in our country now is the one that was from Kent. Right,
that's useful. And then you showed us the route map, road map. And what was quite evident from that was that Easter, which is the beginning of April, is before the 12th, and which by inference means that people should be complying with the current restrictions until the 12th. So they apply across Easter, don't they?
That's correct. And it's minimised travel is that key thing. So it's actually how do we and realise Easter is really important, a really important festival, a really important holiday for people. And people have been in these restrictions for a long time, and I realise that's really difficult. And as the vaccine, and it is, if the right word is, taking hold in our population, so working really well, people are taking that up. And we've had about a 50% uptake of the vaccine on the Isle of Wight, which is really good news. So 50% of the population had one dose. And we are seeing the impact of that on hospitalisations, which is positive, as in hospitalisations coming down. So as we do that, and as more people get vaccinated, we will begin to be able to have more confidence that opening up will not impact on the population in a detrimental way.
Thank you. And that leads me nicely on to my next question. You're absolutely right. I think the response to people on the island to go and getting vaccinated is terrific. And I think the other thing I get feedback on, I'm sure others do, is just how professional and efficient the staff are at the vaccine centres, which is a bit of a team effort between health, ourselves and others. And I just get that on the record. It's been amazing. But then we all watch the news in the last 24 hours, 48 hours, and we hear lots of noise about vaccine shortages. So anything you can give us an update on there?
Yes, like many of us, we're learning from leaders yesterday around the shortage. I know they're making a plan for how to manage that. We knew that as the vaccine rolled out, and bear in mind this is an NHS responsibility, that there would be some bumps in the road. We'll be dealing with those bumps in the road to make sure that we can vaccinate the population as quickly as possible. and that's what we're trying to do alongside those people needing second doses now. So we'll be looking at all of that to make sure that the population can get its vaccine as quick as possible. I think it's a bit early. I think we all learned last night around this, so we're just making the local plans to make sure that continues to roll out. As you say, it's been a great effort by all and partners, and the population taking that up.
Okay, just a couple of other things I wanted to move on, which is around communication. First of all, having had probably nearly a year of being able to publicly communicate messages, we reached that magic time of the pre-election period, and certainly the main communicator that I was using, Outbreak Radio, will now be blessed with the skills of the chief executive instead of me. But my question was, this 12th of April, which is quite a significant date, is there anything you're hearing or seeing that indicates that will still stick to that time? Because that seems to be quite significant. It takes us beyond Easter, but more importantly, it is a point when island people particularly can start to open up to some degree, if that's put it like that. Any comments on that?
Yeah, thank you, Councillor Stewart. I think as I said previously, that we want to make sure as things open up, we monitor that, and that be done nationally. But also, as I said, it takes 2 or 3 weeks for any of these changes to see an impact. So when lockdown came in, it took 2 or 3 weeks for the rates to come down. Yeah. So 12th of April is the date they set for the earliest, so we can evaluate what's happened with schools opening up, with all these other things I've just mentioned, and then we'll move into the 12th of April. So I understand how difficult it is to plan for that. So I say to people, do plan, but do be warned that things may change if the virus doesn't go as we expect, according to what we're planning. But I think it's right to plan for that date, but then people may need to consider how they adapt their plans. But also thinking, what more can I do to be COVID safe when I do open up my hairdresser, my zoo, my gym, which is really important.
Thank you. And I've got one more, and I'm going to ask, I think Claire might have a question as well. I, like a number of people, observed the one-to-one social distancing that happened last weekend when people were kind of out and about. I suspect Easter will have an increased number of one-to-one people out and about. So it does tell me there is quite a pent-up energy in the community now to when they can to get together. But I'm hoping you'll agree with me that, and I think there was tragically at least one more death in the hospital. It was announced recently in the last couple of days, which is just a reminder to people that this virus hasn't gone away and how important it is. I know I'm being probably commented on as being a bit cautious on various things, but I think, and I'm sure as I bring in Claire, she'll echo this, this is a high risk. It's not gone away. And I'm just looking for your message really to the community that says, don't break the rules now. We're too close to success to get to do that. And then I'll go on to Claire. So to comment from that side.
I think you're right. It's a thank you to the population for doing what they have done to get it to this point, and please continue to do that, and to be really mindful that actually the virus is still around. We're still in a pandemic, and yes, it's come right down, but we saw what happened in January, that it could go up again if we don't follow the rules. And I'm really grateful for people to do that. And please do stick to the rules. Hands, face, space. Think about all those things as you go about, and with those in mind, we'll keep the virus under control.
Thank you. I'll go around now. First of all, Claire, because she indicated the question.
Thank you, Simon. Could I just ask, as this is a public meeting, so we can give that information out to the public, what is the difference between the tests on site and the community collect, please?
Thank you very much, Councillor Morsdale. So it's with the two tests, they're both lateral flow tests. The tests on site, so if you go to a centre, you can take a test under kind of supervised conditions, and then get your result half an hour later, and you don't need to take a PCR test. If you take them home, you're obviously doing it yourself, so they're less supervised. So if you get a positive there, you need to undertake a PCR test as well, just to confirm that. And it's the two methods. They're slightly differently set up, the tests, in the way they're done, which is why there's two different things. I think as people get more confident and competent at doing the lateral flows at home, we'll see more of that rolled out. And we've seen, you know, I'd encourage all parents to do that. If they've got children at school, you can collect your kits and take that home. And also, but if you want to do that in a centre, that's absolutely fine. And it's really good that we've got different ways to access tests going forward for different people who have different needs. So that's really positive. But I'd encourage people to take a test whichever way they would find most easy for them.
Thank you. Any more questions, Claire? No? Okay. Gary, Peace, if you're here, have you got any questions?
No, can't.
No. Stuart, any questions?
No questions, Leader, but as we're on the item on the agenda on update on the current situation, it might be worth mentioning that we have now distributed the second draft of the COVID-19 outbreak management plan. That's gone out to internally to members of the council's gold group, to those of us on the local outbreak engagement board, to the health protection board, to the integrated care system and the local resilience forum for comment and adjustment. It's still in draft at the moment. We are aiming to publish that on the 31st of this month, and that forms part of our ongoing planning as we gradually emerge from lockdown in accordance with the government's roadmap, and also obviously taking into account what's happening locally on the ground with the number of infections and the management of that we see. So that is happening largely in the background, but I mention it here in this public forum because it's important that everyone knows that that planning continues effectively, and that helps us to make sure that we're in the right place when we get to the various elements of the roadmap, and unlocking happens in a careful and managed way. Thanks, Chair.
I'll go to the Chief Exec in a second. I think he wants to make a question or comment, but just building on what you've said, and Simon may have a view on this, it appears to me, and I do still get quite a few emails from island residents worried about the people coming over from the mainland, etc., and they kind of like, you know, for us to be very protective. I know we've worked very hard on a travel charter, which officers have been putting together, which is very good. I know that Visit Isle of Wight have been very managed in wanting people here at the right time, and I'm very supportive of all of that. But it's that little bit of reassurance to people on the island that all the steps are being taken to make them safe. You know, there's all sorts of issues. Councillor Peace is just saying, you know, can we pay people COVID test kits? All sorts of things being suggested. But what I think the real question is, do you feel we are in the right place in terms of, as we open up, to actually keep the island secure, but at the same time, as Councillor Hutchinson's rightly indicated, we need to open our island economy for the future of the economy? That's a long-winded question. I apologise.
Yeah, you go, Simon, then I'll follow up.
Thanks very much for both those questions. And Councillor Hutchinson's right, we are refreshing our plans in light of the new Contain framework, which was published last week, the National Contain framework. We're doing that. There's a number of things that are in place now that weren't in place previously. So we've got a very strong local test and trace service. So the tracing service, that's really positive. And, you know, if someone had asked to isolate, we'd ask them to follow that advice and do that. And we can offer support for that. And obviously we want to keep the rates down as low as possible. And as we see any situations that we need to react to, whether that's, as I think you mentioned earlier, a situation in a school or college, we react very quickly so that we can protect the rest of the population, which is why, for example, if a parent takes a lateral flow and finds they're positive and they keep their child at home to self-isolate as a contact, that will stop it spreading into the school. So all these things help. Whilst it's frustrating that people want to get back to normal as the economy opens up, these things need to be part of our life going forward. So there's a lot of new things in place that enable us to move forward in a positive way. However, as we said previously, it's in that context that we need to be really mindful that we are still in a pandemic.
Yes, thank you for that. Takes you nicely on to the Chief Executive.
Yeah, thank you, Chairman. I mean, I was going to ask Simon a very simple question to comment on, actually, and then I'll come back to the other issue. But I think, Simon, really important to stress on the 29th of March, the rule of 6 and the 2 households requires social distancing between people who are not in the same household. So yes, you can get together as a group of 6, but you do still need to be 2 meters apart, face covering, all the right protection and all the proper behaviours that we've been all doing so well with for so long. I think on the second point, Leader, I think that whole issue about visitor travel, the economy reopening, I think that's really important. And we are doing some work with Visit Isle of Wight on that at the moment, and everybody who is part of the visitor economy, and actually so much of our economy does depend on the visitor economy, that it's important we can get that opened and open safely as quickly as possible. So we will be working on how do we build the visitor charter to help keep people safe, not only those who come to the island, but those who live here. So we get that mutual respect between the 2 parties. We have to remember that at the moment there's no indication we're going to go back to tiering. So what applies in one part of the country applies in the rest of the country. So all the rules around minimising travel and thinking in a COVID secure way about how you do things, all those things still apply, and we need to encourage people to use those and follow those good behaviours wherever they come from. And I think if we really do that and we really promote and push that, then I think we can get our economy and get our island open safely. We had a very successful and very safe August last year as we came out of the last lockdown, because of all the work that everybody did in trying to open in a COVID secure way. And I think the lessons learned from that we need to apply again as we come out of this particular lockdown, and make sure that everybody can benefit, but at the same time everybody can stay safe.
Thank you. Good. Is there any other points anybody wishes to make on the call? I'll just then going to go to Wendy and just check what media messages we want to deal with today. Wendy, did you want to come in at that point?
Thank you, Chair. I think we've talked a lot about some of the really important messages in relation to COVID and the easing of restrictions and local economic sectors opening up. Our key message at the moment, that is our header for everything as we move towards further easing of restrictions, is that all of our actions make a big difference. So, as we've discussed already this morning, the more we continue to remember hands, face, space, ventilate, the more people receive their vaccines, the more people use the community testing options to help us identify cases, the more people continue to self-isolate if they have COVID, the more we can collectively do to reduce rates of transmission and prevent the spread of infection. And John's, the Chief Executive's alluded to the fact that we had a very successful August last year, and that was because of that collective response that we had on island to managing our own behaviours, taking that personal responsibility ourselves and doing things in a safe way. And we need to continue that collective response on island as the restrictions are eased. Those good behaviours don't actually prevent us from doing things. They don't prevent us from meeting friends and family and colleagues in more places. What they allow us to do is meet people in a safe way. So for our own personal safety, as well as the safety of our friends and family, it just makes so much sense to keep continuing to do those behaviours. In terms of other messaging, we will continue to promote the community testing and the rollout of the vaccination programme with appropriate messages at the appropriate time. We'll also be working to support those people who have been shielding, and we found out today in the announcement that from the 1st of April, people will no longer be required to shield, but we will continue to work with those individuals, the community hubs and the voluntary sector to provide all the advice and guidance to help people who may be anxious about coming out again after shielding, and to ensure that they know where they can find support and help. We've already talked about the next significant date on the government's roadmap out of lockdown, and that is the date of the 29th of March, at which point people will be able to meet outdoors. And I think it's really important to stress that that is about meeting outdoors. We've talked about the rule of 6, and the 2 households can also meet outside. I think the other important change that we have to realise is that whilst staying overnight is still precluded at this point in time, people are able to meet more. They will no longer be legally required to stay at home. We will have the message of continue to work from home where possible, but people should not be staying overnight from home, and we must continue to minimise travel. However, that does mean that we should expect to see more people moving about on the island after the 29th of March, because quite understandably, people will want to catch up with friends and family and colleagues, and they will be able to do so in line with the restrictions easing. And that's also likely that that might mean that we do see more cross-Solent travel, as people may want to travel both to the island and from the island to meet friends and family outdoors. And again, that's entirely in line with the restrictions easing. Looking forward, I think it's important to remember and note that next Tuesday, the 23rd of March, sees the first anniversary of the national lockdown. And we've all come such a long way, and we've learned so much since then. And we will be supporting, as an organisation, the National Day of Reflection. And then finally, we've also alluded to this as well. In the coming weeks, we are organising a number of sessions for different economic sectors to provide advice and guidance with regard to restrictions lifting and the regulations associated with operating sectors in a COVID secure way. And we will continue to do that as we move towards the dates in the roadmap and new sectors are able to open up. And we do work very hard with Visit Isle of Wight and our colleagues at the Chamber to make sure that we share business advice as much as possible. And we have been particularly looking at how we can provide not only a safe environment for people to visit the island when the time is right to do so, but how we can provide the community on island with the reassurance that it is safe for visitors to come here. And I think that ends the roundup of the messages looking forward in terms of where we are with communications, but I'm happy to take any questions on that.
Thank you. I think that's very useful. Councillor Mosdell's got a question for you.
Thank you, Wendy. I'm getting questions from residents regarding business grants. So businesses who have received the second part of the rolling grant, but I've had businesses contact me that under a rateable value of 15k, there might be other stuff that they can apply for. As part of our comms message, we're doing lots of stuff to the general public of what we should do to keep ourselves safe and things like that. Could we keep reiterating and updating the messages, what people could actually apply for, so those businesses are still there when people can actually go out and do more? I think it's a really important piece of comms. Yes, as a local councillor, we can help as much as possible, but our comms and our media that we do get out is really good. So if we could reiterate some of those would be really good, with links that small businesses can apply for to get more help.
And we heard in the budget announcements earlier in the month that there were going to be restart grants. We've been informed that there will be 2 types of grant available again moving forward. One will be a rateable value grant, one will be a discretionary grant. They won't be available to be paid until after the 1st of April. And at the moment, we're awaiting the final detailed guidance from government as to how they want us to administer those grants. So as soon as we have anything, we will put the information out through our channels and direct to those businesses who have already been part of the work that we've done in terms of sending out business grants to ensure that as much information is out there as early as possible. We're hoping that we can make this almost like an automated payment and much less of the need for an application, but that does depend on the information that we receive from government as to how they want us to administer the grants.
Brilliant. I've got one more thing. It's my understanding, some of the meetings that I've been attending, that we have been one of the best councils in the country for actually getting these grants out in a timely fashion. Could you explain that bit more, if it was just something that I heard? I
think there are two issues to the business grants. One is getting business grants paid, and those are the rateable value grants. But the other issue is in relation to this discretionary grant, and we've been very successful in both areas, because we have been able to ensure, and if you take the last rolling period in particular, the majority of our 2,200 odd businesses that were eligible for a grant were paid within 2 weeks of us being notified that that grant was available. Now that is a huge number of payments to get out the door, and a real success for the council. And in terms of the discretionary grant, I think we're one of the few local authorities across the country that has had an open discretionary grant, received applications, and actually paid out a considerable amount of that discretionary grant to a wide range of businesses on island. I think in total we've benefited on island to something like £79 million worth of business grant in the last year that's gone out to businesses, and that's a huge number of individual payments to businesses, and no small feat in terms of administrating that process.
So to end my questions, and it isn't a question, could you pass back on behalf of Cabinet our thanks to all the members of the team that have worked so hard on behalf of island businesses to give them a chance of surviving this pandemic. My understanding is that there is people that never worked within that department before, that have, you know, moved, had to retrain, etc. So on behalf of the Cabinet, I'd really like to pass our thanks back to them, please, on behalf of the island.
Of course.
Yeah. Finally, one for me. It does genuinely feel like we're moving into what I call my head transition position. So, you know, for all the good work that's gone on, we've brought the island to a point, and I'm grateful to particular volunteers who I think have done a fantastic job, to where we can start looking at that recovery plan that Councillor Hutchinson rightly pointed out. There will be businesses, I'm sure, who have been furloughed away, stopped or whatever, who will be looking for a bit of advice and support. And I think you mentioned earlier the business support meetings that are coming in. Is there anything else we can give them, contact number or whatever, that what if they're not sure they've got it right, if that's the right way of putting it, they can double check, so that we don't because we don't actually want to catch businesses doing it wrong. It's not in our interest or the public's. We want them to do things right. And I'm just wondering if they're not sure, is how they actually phone up, check up and say, look, we think we're set up okay, but can somebody check this? How would they do that?
Thank you, Chair. I think there are two routes into asking that question of the Isle of Wight Council. The one is through our normal Isle of Wight Council contact centre, and information and advice will be provided. The other route is to email our regulatory services team, and that can be on the email covidregs@iow.gov.uk. And the team there triage all of the emails and queries that come in, and they will respond accordingly.
Right, that's useful, because I think I don't want businesses worrying they haven't got it right when we actually want them to now be able to do it well. So that's good. Okay, I think I've covered the entire agenda, unless anybody's got anything else they wish to raise. So thank you, everybody. Thank you for Simon Bryant and everybody else who's been on today. Thank you for those of the media are listening, and we look forward to speaking to you in due course. And I'll now close the meeting.
Chairman, you've missed off members' question time.
Oh, I apologise.
I know we haven't received any, but it still needs to be done.
No, there could be a member listening out there with enthusiasm who wants to ask a question. So if you're out there, ask your question. If you're not, don't worry.
I don't think there is.
No, we have none. So let's resolve that one. Okay, we'll call the meeting to a close, and thank you, Marie. For that. Bye.
Thank you, Chairman. Bye.
Thank you.
Bye-bye.